UnitedHealth under federal investigation for civil fraud. Imagine this. One of the biggest names in healthcare is now under the microscope of federal investigators. UnitedHealth Group, a titan in the industry, finds itself at the center of a Department of Justice investigation. As of July 24, 2025, this revelation sent shockwaves through the financial markets, causing UnitedHealth shares to dip. But here's where it gets controversial. The investigation isn't about some minor accounting error or a clerical oversight. Federal officials are digging deep into how UnitedHealth records diagnoses, which directly impacts the amount of Medicare payments the company receives. This is a crucial issue because UnitedHealth's UnitedHealthcare division is the largest provider of Medicare Advantage MA plans in the country, covering over 8 million people aged 65 and over. For those unfamiliar with Medicare Advantage plans, these are privately run versions of the government's Medicare program. They offer additional benefits beyond what original Medicare covers, making them incredibly popular among seniors. However, this popularity comes with scrutiny. The investigation focuses on whether UnitedHealth has been accurately recording diagnoses to maximize its Medicare payments. This isn't just a financial issue, it's a question of trust. The company's response to the investigation is telling. In a Securities and Exchange Commission filing, UnitedHealth stated that it has a long record of responsible conduct and effective compliance. However, this year, the Wall Street Journal reported that federal officials had launched a civil fraud investigation into UnitedHealth's practices. Why does this matter? The stakes are high. The company's UnitedHealthcare business has been under pressure in recent quarters due to rising care use and rate cuts. A federal investigation could lead to significant financial penalties and damage to its reputation. UnitedHealth claims it only became aware of the investigation after reviewing media reports. The company reached out to the Justice Department to cooperate fully, but the damage has been done. Since December, when UnitedHealthcare CEO Brian Thompson was fatally shot on his way to the company's annual investor meeting, the stock price has been struggling. As of this meeting, UnitedHealth shares have dropped 1.7%, a clear indication of investor unease. But what does this mean for the future of Medicare Advantage plans and the millions of seniors who rely on them? And this is the part most people miss. The investigation could have far-reaching implications for the entire healthcare industry. How will this play out? Will other companies come under similar scrutiny? What does it mean for the future of Medicare funding? The questions are many, and the answers are still elusive. But one thing is clear. UnitedHealth's investigation is a stark reminder that even the biggest players in healthcare are not immune to federal oversight. What do you think? Is this a necessary step to ensure the integrity of Medicare funding, or is it an overreach of federal power? Let's discuss in the comments. UnitedHealth reverses stance on DOJ Medicare investigation. Imagine a healthcare system where the pursuit of profit outweighs the well-being of patients, and the very fabric of trust is torn apart. This is the stark reality that UnitedHealth Group, one of the nation's largest health insurers, is facing as it reverses its stance on cooperating with the Department of Justice DOJ investigation into its Medicare practices. But here's where it gets controversial. The company's sudden change of heart has sparked a flurry of questions about the integrity of its business practices and the potential consequences for taxpayers. In a shocking turn of events, UnitedHealth Group has announced that it is cooperating with the DOJ investigation, a stark departure from its previous dismissive response to reports of a probe. This about-face has left many wondering what prompted the company to change its tune and what this means for the future of Medicare. The investigation, which was first reported by the Wall Street Journal in May, centers on allegations that UnitedHealth Group gamed the Medicare system to inflate its federal payments. The company's Medicare Advantage business, which provides coverage to millions of Americans aged 65 and older, has been under scrutiny for its practices of collecting diagnosis data to boost government payments. But this is not the first time UnitedHealth Group has faced such accusations. A whistleblower lawsuit filed in 2011 by a former finance director at the company alleged similar wrongdoing, and the company is still fighting the case. The DOJ investigation has also shed light on the company's risk adjustment practices, which have been criticized for prioritizing profits over patient care. Insuring patients with more health conditions leads to higher federal payments, creating a financial incentive to make patients look as sick as possible on paper. And this is the part most people miss. The company's practices have been under scrutiny for years, yet it has managed to avoid significant financial consequences. But with the DOJ investigation gaining momentum, that may be about to change. The company's shares have taken a hit, falling 4.75% on the day of the announcement, and analysts are warning of potential fines or clawbacks of previous overpayments. As one analyst noted, these now acknowledged investigations highlight key risks that have cut into shares in recent months, and we suspect fines or clawbacks of previous overpayments related to its NA plans are possible, if wrongdoing is found. The uncertainty surrounding the investigation has also led to a decline in investor sentiment, with some analysts predicting a financial penalty that could total billions. But here's the question. Will UnitedHealth Group's cooperation with the DOJ investigation be enough to restore trust in the company, or will it be too little too late? As the investigation continues to unfold, one thing is clear. The stakes are high, and the outcome will have far-reaching consequences for the healthcare industry as a whole. So we ask you, do you think UnitedHealth Group's cooperation with the DOJ investigation is a step in the right direction, or is it just a damage control measure? Share your thoughts in the comments below.